Okay, this is part 18 from the book Prevent and Reverse Afib and CHF by me, Pete Rogers. We're on page 82, like part 18, going around giving excerpts from the book. We were just talking about William C. Roberts, the greatest cardiac pathologist who ever lived, who did thousands of autopsies on patients who died from congestive heart failure, myocardial infarction, cardiac arrhythmia, and whatnot. And he claims that by far the most important risk factor for development of coronary artery disease is elevated blood cholesterol, especially LDL cholesterol. He says ideally you'd like it even lower than 50, but he's a big pusher of statins. I think he was getting supplementary money from the company. And he believed that cholesterol was the end-all be-all. I think cholesterol is just a subset of things that make the blood more prothrombotic, prone to clotting, because it overcomes the zeta potential, meaning it has a positive charge, it's big enough in size. Red cells have a negative charge, so it sticks them together. Sticking red cells together is called blood sludge, rouleau formation, stacking coins in French. Means the blood's thick. Why do you have a blood pressure? To pump blood to the top of your brain, your cerebral cortex. If you're pumping thin blood, you don't need as much pressure than if you're pumping thick blood. Thin blood's like water, thick blood's like a milkshake. Okay, so pressure has to go up. All right, so anyways, you want to avoid things that make your blood thick. What else is going to do that? Leaky gut, because then you get the bacterial endotoxins, LPS, LTA, lipopolysaccharide, lipoteichoic acid, and they also cause the fibrinogen to change its shape from secondary protein structure, alpha helix, a beta-pleated sheet. Now they stick together, the beta-pleated sheet configuration. It's called amyloid clotting, fibrinolytic clotting. All right, so that makes your blood more prothrombotic. If you're really dehydrated, your blood's a little thicker, more prothrombotic. If you're iron overloaded, you get ferrous redox cycling, Fe2 plus, Fe3 plus, giving off electrons. That also distorts the shape of fibrinogen in the same way as the bacterial endotoxins, LPS and LTA, causing a secondary protein structure shape change in the fibrinogen, making it more prothrombotic, makes your blood thicker. Okay, and those all cause hypertension. Hypertension damages the arterial wall, causes atherosclerosis. Atherosclerosis is a blood clot. So anyways, people just say statin, I think, because they don't know anything else. That's what they're trained to say in the medical world. But, my attitude about statin is statin's got a big problem. Statin is a mitochondrial inhibitor. Uh-oh, spaghetti-o. Mitochondrial inhibitors, when you inhibit them, you increase your risk of diabetes. That's, the mechanism of diabetes is that saturated fat in particular amongst fats inhibits electron transport in the inner mitochondrial membrane. And there's a whole bunch of other ones. And they also, mitochondrial inhibitors can increase your risk of AFib, can increase your risk of cancer. Not good. So the benefits of lowering the cholesterol must outweigh all the other problems. So if you're a real high-risk CAD patient, but why not just go low-fat vegan diet? That's what works best for the vast majority of people. That's what I do. That's what I would do. I could do whatever I want. I got friends in every field that'll help me for free. And I can tell you, after studying this for many, many years at an intense level, I'm a low-fat vegan with no oil, okay? And I avoid high-fat foods, all that crap. Because people tell you, oh, sat fat is so atherogenic, raises your LDL cholesterol. Then the same person will say that will turn around and say, oh, yeah, but nuts and seeds are good for you. Yeah, right. They're full of sat fat. How are you going to do that? Okay, they'll say olive oil is good for you. Olive oil's 11 to 14% sat fat. How's that going to be good for you? That's BS. That's, inconsistent logic. The thing cannot be and not be the same thing at the same time. We're not talking about Heisenberg's cat. It's BS, okay? So, anyways, just so you hear that. Some people also say, oh, just take this little spice and magically your LDL will come down. To me, it sounds like BS. Most powder foods are contaminated. I wouldn't take any powder food. Okay, so anyways, and I realize there's some really rare patients that have hyperlipidemias. I don't know the exact number of them. Let's say 1 out of 500 or something. People quote you different numbers. Okay, William C. Roberts believes the Ansel Keys 7-country studies was as definitive as you need to know that lowering blood cholesterol is the same way to go. You know from other studies in Finland, Pekka Puska's work, like 80-something% lowering of coronary artery disease by just getting rid of the high-fat foods and stopping smoking, decreasing dietary salt a bit. Roberts says if one gives herbivores like rabbits or monkeys a diet high in cholesterol and or sat fat, they will get atherosclerotic plaques. And they're similar in their physiology to humans. And Dr. Roberts also said people should eat a plant-based diet, keep their BMI less than 25, don't smoke, don't drink. Okay, very good. Now we're going to talk a little bit about Gregory Sloop. Gregory Sloop is the pioneer of atherothrombosis theory. He's also a pathologist, and pathologists are the best ones at atherosclerosis because they just look at it under a microscope. When you look at it under a microscope, you say, hey, it's a blood clot. That's in comparison with You know, again, I used to think cardiologists, cardiac surgeons, cardiovascular thoracic surgeons, vascular surgeons, myself, an imaging guided surgeon, doing lots of vascular interventional radiology work, angioplasty, stenting, especially in the iliac arteries, lower extremity arteries, a couple other locations too, but that's the main place. I thought we were the big experts in atherosclerosis, but we're not. We're just plumbers. We just fix a blockage, okay? Stent it open, bypass it, clot dissolver, atherectomy, something like that. But the real expert of atherosclerosis pathologist looking under a microscope. What is it? It's a blood clot. Okay, and you know, he was a big, you know, teacher of everybody about the atherothrombosis theory, how, you know, all red blood cells have a zeta potential, meaning negative charge in their outer surface. Things that overcome that zeta potential because they're big enough and positively charged will stick those red cells together. Uric acid will do that too, and you get that elevated from drinking, you know, beer, eating high fructose corn syrup. Here's Sloop's book, Blood Viscosity, its role in cardiovascular pathophysiology and hematology. It's a great book. It's totally paywalled. You know, it was last time I looked, it was over $100 in cost if you look up online to buy it. And they paywall the truth. They don't want the pros knowing the truth. Okay, and everything Sloop said, I double checked it because I look at tons of CT angiograms, MRA, magnetic resonance arteriograms, and I've seen many, many thousands of catheter arteriograms, the brain. I've also seen tons of them in the lower extremities, the heart, etc. And Sloop is correct. Okay. Atherothrombosis is a thrombotic disease, not an inflammatory disease. It's primarily a clotting issue, okay? And I should have figured that out because I look at CTs of the abdomen all the time, CT angiograms of the abdomen and lower extremities. You can't tell the difference between atherosclerosis and a clot. It's because they're the same thing. And they recanalize in similar fashion, okay? They're laminated in similar fashion, like the rings on a tree, okay? You have this ongoing steady state between dissolution and clotting. That's just one of the papers Sloop wrote. I actually became friends with him. I talked to him on the phone. He's dead now, but all of this stuff, I spoke to him in detail about it on the phone in person. Okay, so here it is, a picture of it. Red blood cells have negative charge on the outer surface called a zeta potential, thus they repel each other. The two negatively charged things push away. But you get a positively charged thing in here, a bridging molecule, it'll stick them together. Fibrinogen, especially when it's undergone an amyloid transformation due to LPS, LTA, due to viral particles, or due to iron overload with excess free iron, ferrous redox cycling. That'll do it. Uric acid will do it. LDL, cholesterol elevation, IgM elevation, triglyceride elevation, chylomicron elevation. They'll all stick them together, overcome the zeta potential. They've known this in blood banking, you know, for many, many decades because they have to deal with the blood. But it's not taught to medical students. It's not in the medical books. The higher your LDL cholesterol, the higher your blood viscosity, meaning the thicker your blood. The higher your hematocrit, the thicker your blood viscosity. Red blood cells got a size of about 7 microns in diameter. Capillaries about 5 microns in diameter. So that means that the red blood cell has to fold back on itself a little bit, has to deform itself to get through that capillary. You want to know these numbers. These are valuable numbers to know. Red blood cells about 7 microns. Capillaries about 5 microns, okay? If you stick them all together by a bridging molecule, you're making like a submarine sandwich. It's hard to push that thing through a capillary. Here's a rouleau formation. Again, that means like a stack of coins in French, okay? Blood sludge is what it's also called. When they're all stuck together, you know, it's going to be harder to push them through the capillary. So pushing thick blood through the vascular system, pressure has to go up. If you're eating a lot of dietary salt, it's a vasoconstrictor, meaning it inhibits endothelial nitric oxide. So you're going to have a drop in nitric oxide. That's your main vasodilator released by the endothelium into the blood. Well, when it goes into the blood, it's a gas. It's antiplatelet, so it decreases clotting. It diffuses into the wall to the vascular smooth muscle cells that are wrapped around the endothelial cells lining the small blood vessels, and it causes them to dilate, so you get vasodilation. So if you don't have that because you're eating a high salt meal, you got vasoconstriction instead. Uric acid is also a vasoconstrictor. Then what's going to happen is you're going to be pumping thick blood from the high fat, high sodium diet, thick blood through a constricted system. Pressure is going to go up, up, up. Okay, that's all we're going to do for today. I hope you found that helpful.